All right, dental hygiene in Russia. In the past, in Russia, dental hygiene and dentistry in general was not a priority, but within the last decade, there's been a huge increase in the number of dentists and dental hygienists in the effort to serve their population. In Russia, there's a population of about 142 million, and there's over 3,500 working dental hygienists to serve that population. Anyone aspiring to be a dental hygienist has 24 different dental hygiene schools that they could attend. The dental hygiene programs in Russia are 2-year programs, and this gives them a secondary learning degree. And to qualify to practice, you have to have your diploma of dental hygiene and a certificate. You must also be fluent in the Russian language. Dental hygiene scope of practice in Russia. They're able to diagnose oral diseases. They provide preventative maintenance and care. They can care for orthodontic appliances. They can do prosthetic and surgical. They care for prosthetic and surgical patients. And they develop and applicate the health programs for all ages. The regulating body is the Ministry of Health for dental hygienists and a lot of other health professionals. And their professional club, kind of like the ADHA here, they have the Professional Society of Dental Hygienists in Russia.
So we also did dental hygiene in the state of Utah, and their regulating agency is the Division of Occupational and Professional Licensing. It's divided into 7 bureaus by similar occupations, and dental hygiene is grouped in dentistry with dentists and assistants. It's currently in charge of reviewing applications for licensing of over 60 occupations, from dental hygiene to doctors to building inspectors and land surveyors. The dentistry board members there, it's made up of 6 dentists, 2 dental hygienists, and 1 public member. And it seems like terms are limited to 8 years for dental hygienists, 4 years for public members, and 4 to 8 years for dentists. So direct supervision is the dentist is in the room with the practicing hygienist for face-to-face consultation if needed. And indirect supervision is the dentist just needs to be on premises and available for face-to-face confrontation, not necessarily in the operatory. In general supervision, the dentist needs to authorize the service, but does not need to be present when the service is provided. And in Utah, hygienists are only allowed to practice under direct, indirect, and general supervision. They are not allowed to practice under remote supervision there. The services provided, they can take x-rays, they can do prophylaxis, root planing, soft tissue curettage, topical anesthesia, impressions, study casts, fluoride, place and remove dressings, pin and fissure sealants, and remove sutures, all under indirect supervision. And then local anesthesia and administering nitrous oxide is performed under direct supervision. And some limitations to the practice, like I said before, nitrous oxide and local anesthesia are administered with a dentist authorization and direct supervision. The board examinations, you can take CDCA, which was formerly NERB. You can take CERTA, REB, CRDTS. And first, you have to have graduated from an accredited dental hygiene program somewhere in the United States. Associate's and bachelor's degrees are accepted, and then you take those 4 national boards. The passing score is 75%. And for anesthesia, you have to have anesthesia portions that you must take to receive a passing score. Once you have a license to practice, the period is 2 years before you have to renew your license, and to do so, you have to have completed 30 hours of continuing education. And according to the ADHA website, most states have a state or regional board exam on laws. The DOPL website is vague, but it seems like if you hold a license in another state, you just send in an application and you're approved or denied. And if you do not hold a license in another state, so if you're a new graduate, then you would send your national board scores to the state, send in an application, and then the state would give you further instruction, probably for the written exam. Specifics aren't mentioned on the DOPL website. For dentists, it was, but not for dental hygienists, and the dentists have to take the written board. Some interesting facts that I learned. You are able to practice without a license in Utah, but this only applies to dentists, and they have to be licensed in another state and provide free services. And this excerpt from the Dental Hygiene Practice Act, dental hygienists cannot take impressions or registrations to supply artificial teeth as substitutes for natural teeth. So the hygienist cannot take crown impressions or do bite registrations in regard to crown prep, but we can do that for orthodontics, retainers, and trays. So our sources.